Another thing that came up is that in regards to the education sector is that the teachers are now considered frontline workers, and that means that they're actually getting priority even as the vaccines are meant to be coming, according to CAS Mwangangi, towards the end of February. We should see a potential of rolling out, the vaccines, and so they'll be giving 2 intermittent doses in 28 days. And so the priorities here are the healthcare workers, the police, the military, and now the teachers as well. These are some of those who are considered to be priority in regards to the vaccines. And so there are various concerns that have come up in regards to the back to school. One of them is about when you've got schools which have got a lot of learners, be it pupils or students, and they are boarding schools. So what happens in terms of social distancing in the schools, because we've got schools that have over 1,000, learners in the schools. And then aside from that, there's also the concern about teachers who are over 58 years old, 58 and above, as has been prescribed. They are in the vulnerable group, and so the concerns are what happens if they work from home. Will they be rendered irrelevant or, then dismissed from their jobs? And further to that, there is also the concern of, you've seen the children learning under trees, which again, Magoha insists is a healthy way to go about it because of the fresh air. But then there are those who may be affected by the, the vagaries of the weather, be it dust, because we've seen some of them in the dusty areas. So there are those who may be asthmatic or otherwise. So I put the question to them to just ask, so what considerations have been put into that? So here are some of the views of the government officials on these different issues.
So I don't understand why you are asking, what about the boarding houses? A school as popular as Kenya High School, which has now close to 1,800, would you want some of the children, they are your children, would you want some of them to transfer to day schools? Or would you rather that they observe the protocols as much as possible, minus the social distancing, and we hope for the best? It is not government, it's also you, including members of the fourth estate.
When it comes to the issue of open-air learning and asthmatics, I think this is something that we would be willing to really engage with you and perhaps even have you put out stories and articles, interviews, when it comes to parents who have children that have chronic illnesses. I'm talking about the asthmatics. I think the question that was asked was on asthmatics. Remember, we have children who have bronchitis, we have children who have sickle cell anemia, we have children who have kidney issues, diabetes. We've been able to, engage with our schools to be able to have that database. So having a chronic condition registry of children across the different schools, that's one of the key interventions we're putting in place. Another intervention is really having the parents take responsibility.
Like I said before, is to assure our teachers that if you are not able to go to school for one reason or another, nobody is going to sack you. In any case, even before the COVID, our teachers used to get sick, and we have a way of taking care of them through the code of regulation. So nobody is interested, especially when all of us are going through this very difficult time. Nobody would wish to make matters more difficult for any other person.